H, assessment of commercial interest and conflict of interest. So first you need to know what is a commercial interest entity. And so we have put the definition right here on the application, as well as what a conflict of interest is based on the commercial interest entity. We've gone in and tried to help you as well analyze conflict of interest. So nurse planners have the responsibility of assessing the commercial interest and the conflict of interest for everybody on their committee, as well as all speakers and presenters that are at their conference. So part of the process might be that you distribute our conflict of interest form that is attached to this application to everybody on the team, and have them self-disclose based on the information on that conflict of interest form. Then the nurse planner needs to come in and analyze every person and what they've written and determine if there is a conflict of interest or there isn't a conflict of interest. Now that I've said the long details of it, I'm going to give you the shortcut. The shortcut is these three questions. Question number 1, does the activity include content related to a commercial entity's products or services? And the rest of it is that will be used on patients. If the answer is no, stop, check the no box, right here, no conflict of interest, so the forms are not required. Explain briefly how you determined there was no conflict of interest. I just repeat this. The activity does not include content related to a commercial entity's products or services that will be used on patients. Sign your name, attest to it, date it, you are done. We don't need your conflict of interest forms. You don't need to really assess any of the forms. You probably don't even need to distribute any of those forms because the content is not related. But now let's go back. If it turns out that the content might relate to a product or service of a commercial entity that could be used on patients, does that individual or the significant other have they had any financial relationship with the commercial entity in the past 12 months? If the answer to that is yes, then you must go on to question number 3. Is the individual on the planning committee in a position to control content? And if the answer is yes, then obviously you need to go through on the conflict of interest form and you need to resolve the conflict. And there's a number of ways you can resolve the conflict. You can take that person off of the planning committee, off of the speaking engagement. You can modify their presentation in some way so that they are not presenting the information about those services. They are spelled out on the conflict of interest forms. And so if you have a conflict of interest, you need to go to that form, resolve the conflict, because you cannot offer CNE credit for any activity that has a conflict of interest or any presentation of that activity that has a conflict of interest.
If we were to have presenters, doctors or nurses that are presenting mainly educational content, updates and practices that don't have any relation to any kind of commercial equipment or entity. So what you were saying before is that's when the COI are not needed at all?
As long as the topic does not relate to any products or services of a commercial entity, you do not need to you do not need to submit to us any COI forms. But it's up to the nurse planner to analyze if there's any products or services or commercial interest entities participating in the planning or presentation of the topic.
Is that something that we should be asking our presenters when they've agreed to speak? We have a planned topic for them, but should we be asking when we're getting their, final presentation title and knowing exactly what they're going to speak on? Should we be asking them if they have are going to reference any kind of commercial entity, and then that's how we decide if we need the forms or not?
Well, here's my recommend is when you're in the planning process and you've identified your topic and you've identified obviously your learning outcome and your objectives that you'd like to have the presenters present, and then you've made a decision that, oh, these people would be great as presenters. Here's what I would do is I would have them fill out the conflict of interest form, the top half, and self-report for the last 12 months. Have they had any involvement in? The nurse planner then needs to make the determination, is this going to be a conflict related to our topic? Now, like I said, if your topic is all on leadership and you have people that work for, I don't know, Baxter Pharmaceutical, are they still around? But she's going to be talking on leadership. Baxter Pharmaceuticals is a pharmaceutical company. They're not a company about leadership. So although she may disclose that she works for Baxter Pharmaceutical, it's really not a conflict because the topic of leadership is not a product or service that Baxter Pharmaceutical would be distributing for patient use.